So it's really great to be here with you all this evening. So it's interesting when we think about the heart and stroke and diabetes. There are really some devastating statistics that I'm not sure if everyone is aware of. But just to give you a few, which I think are really kind of thought worthy, is African American women ages 20 and older, 49% have heart disease. I don't know if you guys know that. I thought that was pretty critical. 1 in 5 African American women believe that they are not personally at risk. 58% of African American women are aware of the signs and symptoms of, only 58 know the signs and symptoms of a heart attack. And this one, only 36% of African American women know that heart disease is their greatest health risk. But I think the one that kind of baffles me is that women over the age of 20, 49% of us have heart disease. That's almost half. And I'm not sure how much attention we really spend on, those of us that have high blood pressure, how much people really see that connection. There are a few, I'm going to put a website in the chat for you guys. The Heart Association has this My Life Check. And if you get a chance, you may want to just do it. And what it does, it kind of looks at your risks. And it looks at things like your cholesterol, your blood pressure, diabetes, whether or not you exercise, whether or not you smoke, which are the two major factors that has really contributed to women in heart disease are smoking and diabetes. Those are the two biggest factors. But interestingly enough, I was doing some research about heart disease, and heart disease really in women was declared from the United States in 1908. But I think, and you guys can correct me, I think it's only been in the past maybe 50 or 60 years that we've really thought that heart disease was a woman's disease, because mostly everything we heard about heart disease circled around men. So we can add, to a lot of the discrimination, health disparities, and all of those kinds of things that can really address that. But I just wanted to talk a little bit about making those connections, looking at the Life Simple 7, and just kind of saying to ourselves, where do we need to start? So one place is managing your blood pressure. And I don't know how many people know this, but in 2017, the guidelines were that if your top number was 140, if that top number is 140 or higher, and that bottom number is it's 80 or higher. So at 80, even if it's at 80, you're considered, 130. If you're at 130, if that top number is 130, then you need to start thinking about the fact that you may have high blood pressure. So we used to diagnose people at that top number of 140, but now we're looking at a lower number. So if you get your blood pressure taken and that top number is 130, you need to talk to your doctor and see what changes can I make. Also, you need to know what your blood sugar level is. And if you haven't had this test, you want to do the test called the A1C. If that number comes back at 5.4, if it comes anywhere from 5.7 to 6.4, you need to start thinking about the fact that you may be on the road to diabetes. 5.7 to 6.4. And that's a test that looks at how well your body is handling the sugar. We look at your red blood cells that live and grow for about 3 months. And after that 3-month time period, we kind of see where you are and how well your body can manage your blood sugar. If that's elevated, then there's a possibility that if not now, you may have diabetes. So that's a number you want to make sure you check. Your cholesterol, that's another one. Weight loss is important, and it kind of goes hand in hand. Eating better, all of that goes hand in hand. I think probably the most important thing, which we don't think about as much, is the smoking piece. Now, a lot of people still smoke. A lot of people we hang around with smoke. Maybe even we go places where people have smoked. So anytime you're in any kind of area where people are smoking or you're around smoke, there's a risk. All right. And that's pretty much all I had to cover. Just know your blood pressure, know your blood sugar. If you're pre-diabetic, you might want to get into a class. There's all kinds of diabetes prevention programs. There's a lot of virtual programs. If you have diabetes and your blood sugar isn't under control, think about getting into a program, think about getting into class. In the chat, I put our Sugar Mamas boot camp information, our website. We'll be starting a boot camp in late March. We do Saturday morning virtual boot camps where we get all kinds of experts to come in and talk about different areas related to prediabetes and diabetes. So that's pretty much all I had to say.